On January 17, 2008, British Airways Flight 38 took off from Beijing International Airport, taking a northerly route, hitting outside temperatures as low as minus 60 Fahrenheit on their way to London's Heathrow Airport. Just as the plane was about to land, both engines went out. The pilot jammed on the fuel. Nothing happened. By the grace of God, the plane slid onto the tarmac. There were no fatalities. Of the 152 lives on board, 47 sustained injuries. One was serious. Immediately, investigative teams were flown in from all over the world. This was a very difficult case as the cause was not obvious. Ultimately, a theory developed summarizing that a thin layer of water that often lays on top of the jet fuel in the extreme temperatures froze. And at the end of the flight, with the fuel at its lowest level, this layer of crystals was sucked into both engines. It was thought that by attempting to force more fuel to the engine, more ice crystals were brought in, further jamming the lines. A standardized fix was developed and immediately put in place. This was done so efficiently and effectively that every commercial airline in the world had this training fully in place within months. 6 months later, a nearly identical situation occurred on a different airline. Through supporting systems, the standardized training immediately kicked in. The pilot, as opposed to putting on more fuel, pulled back on the fuel, shook the plane, and then put on fuel. Both engines started and the plane landed safely. How is it that in the airline industry, every single accident becomes the fuel for growth, which makes us safer and safer and safer on every subsequent flight anywhere in the world? The roots of this can be traced back to the 1893 Chicago World's Fair. The home of the World's Fair, the so-called White City, was to be lit up with electricity. This was the first time that electricity would be used in any major public display. Now comes the big problem. Millions of people would ultimately attend the World's Fair. The safety and risk associated with electricity on this scale was completely unknown. The insurance companies, asked to help advise on how to ensure safety and to provide insurance for the World's Fair, had no idea on how to evaluate the risks. From this confusion comes the birth of Underwriters Laboratory. The fledgling organization rigorously tested all of the electrical equipment which was to be used, looking for any and all vulnerabilities. This is the start of what continues as a never-ending virtuous circle. Underwriters Laboratories with manufacturers tests and vets products, leading to safer products, safer buildings, and making people safer. With insurers' insight into our greatest vulnerabilities, vulnerabilities based on claims are shared with Underwriters Laboratories. With this focus on the highest vulnerabilities, the virtuous circle continues endlessly, forever leading to better and safer electrical products. A few decades later, a similar situation arose following the Wright brothers' invention of the airplane. Again, in a time of unknown risks, Underwriters Laboratories gave birth to what would become the Federal Aviation Administration, or FAA, through which every single accident becomes the fuel for growth, making us safer and safer and safer on every subsequent commercial airline flight anywhere in the world. Currently, the U.S. healthcare system, due to preventable errors such as hospital-acquired infections, medication errors, and unneeded surgeries, is the third leading cause of death in the United States. As opposed to the virtuous circle created for electrical safety and airline safety, we have a win-lose situation where mistakes in hospital systems and throughout healthcare often lead to huge windfalls of profit for the hospitals and others in the healthcare industry, with the cost of errors passed on to the patient, employers, and the nation as a whole. All of these are embraced by the mainstream insurers as their premiums go up and up and up. The call to action here is to those working in the emerging disruptive healthcare system, where we see the realignment of the win-win-win ecosystem and the potential to create the virtuous circle in healthcare. Members of this emerging disruptive community include healthcare providers, such as those in direct primary care, and free and fair market surgery centers, many of whom are aligned through the Free Market Medical Association and include the Surgery Center of Oklahoma, as well as recovering brokers, stop-loss insurers, third-party administrators, and pharmacy benefit managers. Many of the recovering brokers and their ecosystems members are working through the hub organization Health Rosetta. For small employers, health sharing communities such as Sedera are working to pull all of the pieces together and have the ability to see our areas of highest vulnerabilities. Individually and collectively, the members of the emerging disruptive healthcare system are allowing employers to see ongoing, sustained drops from 30 to 50% and more in their healthcare costs. But even more importantly, they're seeing the lives of individuals, families, and communities lifted. The stop-loss insurers allow self-funded employers to cap their maximum potential costs. With a 40,000-foot view of our highest costs, the stop-loss insurers have a clear picture of where our largest vulnerabilities lie, and subsequently where we should put efforts to make healthcare, like commercial airlines, an industry that is always, year after year after year, becoming safer and safer and safer for those we serve. Like electrical safety and airline safety, we can create the virtuous circle within healthcare on a never-ending basis, lifting the human condition.